We are really honored today to have Dr. Sulak with us. There was an article in the Temple Daily Telegram, maybe about 2 weeks ago, that talked about her involvement in talking to different groups, not only around Temple, but across and from coast to coast, and as I've even learned, internationally. So with that, I just want to share that Dr. Sulak is created Living Well Aware. It's a medically accurate wellness educational program that she founded. It's to soar to a greater level of physical, emotional, spiritual well-being by delivering the best in wellness. She and I had a great conversation, again, about 2 weeks ago, just talking about, the next phase after this pandemic. And that is, taking care of yourself, using this opportunity to basically, it's a wake-up call in a lot of ways. And here's a chance now for that new norm for you as an individual. And she sold me real quick. So with that, Dr. Sulak, thank you so much for joining us today. I mute because of background noise here. So I'm looking forward to your conversation.
Great. All right. And Rod, it's great to be here. And by the way, Kaylee, are we recording this? Because that's A-okay with me. We want to record this and make it available.
Yes, we are. With your permission, we'll be able to hand it out to participants and upload it on Facebook.
Great. Well, that's fantastic, because I want as many people as can to be able to view this later. So hello to all my fellow Central Texans out there. I'm honored that I'm present today on what I consider a very important topic. And I'm just going to go ahead and bring up my slides here. Hold on, let's see if I can get this out correctly. Share screen. And let's see if this is working. Okay, we got it there?
Yes, you're good to go.
Yay. And a very important topic. By the way, for those of you that don't know me, I am, as Rod said, founder of Living Well Aware, and I'm also author of a book, a workbook, a wellness assessment, and also wrote the Adolescent Wellness and Sexual Health curriculum that's used by all the area schools. And I'm a professor of Texas A&M, and I'm a practicing gynecologist at Baylor Scott & White. What I want to talk about today is the coronavirus pandemic, upping our defensive attack against our defense against this offensive attack. So we'll sort of use a sports analogy here. Needless to say, everyone is experiencing the effects of this current situation. None immune to the impact, whether it's physical, emotional, social, financial, spiritual, all of the above. But it's obvious that together we're overcoming this obstacle. The dire predictions did not materialize here in Texas. This is awesome. I know at Baylor Scott & White here in Temple, the original predicted model anticipated massive admissions, overwhelming our current intensive care unit capacity by like at least threefold. Well, it didn't happen, because by and large, our community abided by the shelter in place. Burdens, though, on our families, our community, businesses, the education system, the healthcare institutions, the arts have been tremendous. And while restrictions on our movement are being lessened now, thank goodness, because the dire predictions didn't come about, more businesses beginning to slowly open. We all, I think, realize this pandemic is not going to disappear anytime soon. For all of us, it is an incredible wake-up call. Our well-being is on the line, physically, emotionally, socially, financially, spiritually, and we're being put to the test individually, as a community, and as a country. Now, unfortunately, for many, the only focus during this viral epidemic has been on, what do I do to avoid the virus? Now, that is important. we know what to do now. Wear a mask when you're out in public. Wash your hands a lot. Shelter in place, social distancing. But we can't isolate ourselves forever. And importantly, we don't want to miss the bigger part of the equation. Not only doing what is reasonable to avoid the virus, we definitely want to do that, but upping our body's defense against this formidable offensive attack. Why? We now have a tremendous amount of data on who is most of the worst consequences of COVID-19. We know the characteristics of those being admitted into the hospital, of those being admitted into the intensive care unit, those being placed on a ventilator, and those that are dying. And what I want to do is talk to a little bit about a study this study was published just a few days ago in JAMA, the Journal of the American Medical Association, the most prestigious journal in the world. And this article was entitled, if I can get it to come up here, Presenting Characteristics, Comorbidities, and Outcomes Among 5,700 Patients Hospitalized with COVID-19 in the New York City area. And once again, this just came out a few days ago. Now, these were hospitalized patients, 5,700 of them that they reported on. So these people were sick. Now, and the age range, if I can go over that, the age range was 63. The average age was 63. The age range was actually 0 to 107. 0 meaning there was, some that were only a few months old, less than 1 year of age, all the way up to 107. But the average age was 63. 75% of the patients that were hospitalized were over age 52. 60% were male. 60% were male. And most of the hospitalized patients had comorbidities. In other words, they had pre-existing health problems. 57% had high blood pressure, 42% obesity, 34% diabetes. So we now know the characteristics of who's most likely to have a problem. Now, who died? All right, that's something we also want to know. There were no deaths in this series now, which was a large series, 5,700 hospitalized patients. There were no deaths under age 20. So this is not like the Spanish flu of 1918. The Spanish flu of 1918 affected primarily younger people. I told you of these hospitalized patients, the average age was 63. The average age of death in the Spanish flu of 1918 was 28. A lot of babies, children, adolescents, young adults were killed, average age of 28. So this is not the Spanish flu. Now, males had higher death rates in all the age groups. But once again, no deaths under the age of 20 in this series. 75% of the deaths were in people over age 65 in this study. And that's what we're finding out from other countries also. So we now know the older, the more existing health conditions we have, the greater chance of severity of disease. In other words, being so sick you have to be hospitalized, maybe even having to be in an intensive care unit on a ventilator, the greater chance of dying. All right. So we can't ignore this data. See what I've got there. So we can't ignore this data. Well, none of us should take this virus lightly, even if we don't fall in the riskiest age ranges or we don't have health problems. But it is a wake-up call for America. In my Living Well Aware 1 Minute Wellness blog I reviewed last week, I reviewed the most recent CDC data on obesity in the United States. And if you want to access that, just go to livingwellaware.com and click on the blog tab, and you'll see my latest weekly blog. And unfortunately, the numbers continue to rise for people being overweight, obese, and even having severe obesity. Also, the CDC just came out with data, this week, showing the increasing number of people who have hypertension, high blood pressure in the United States. So in addition to these risk factors for disability and disease, as we age, our immunity declines. Now that's going to put us at risk for developing cancers and having serious complications of all types of infections. I mean, right now, our body is fighting off cancer. There are cells in our body that are trying to turn into cancer, and our immune system's going, nope, we need to zap you. We need to zap you. So we hope our immune system will be effective, but as we age, that immunity declines. And that's why the majority of cancers are are as we age, not in young people. So when we have medical disorders like high blood pressure, diabetes, we're overweight, our body is filled with inflammation. And we now know inflammation is the initiator of numerous medical problems, to include that's what initiates a heart attack, a stroke, autoimmune diseases, cancer, and other disorders. It starts out with inflammation in the body. But here's the good news. There are things we can all do to lower inflammation in our body to help fight off the serious manifestations of coronavirus. These are the same things we can do to help fight off all the other common disorders that are more likely than coronavirus to kill us, like heart attack, stroke, cancer, lung disease, Alzheimer's. What are some of the things we can all do right now to up our immunity, lower body inflammation, lower our risk of suffering from coronavirus and other diseases? So let's just kind of slam dunk these real quick. And this is kind of the focus of a lot of the stuff I talk about in my Living Well Aware program. So number one is we can eat what I call real food. Eat an anti-diet. And what we're talking about is eating primarily plants, but you don't have to be a vegan. I always say, I have a ranch, I own cows, I eat them. I just don't eat as many as I used to. And one of the best ways we can lower inflammation in our body is to eat healthy. And one of the best presentations I've ever heard on this was by Dr. Dawn Sears. She is head of gastroenterology at Baylor Scott & White. And I've heard her speak many times on numerous health topics. And she is passionate about us taking ownership of our health. And she gives a great talk on how what we put into our mouth that goes into our GI tract rules our health. It rules our health. And even though she's a gastroenterologist, she tells people, eat healthy, try to avoid all those medicines that are out there for stomach problems and stuff. And I just heard her recently speak on that. So number one, eat real food. Number two, one of the hottest things going now is glycemic control, or what we call blood sugar control. And if you're into wellness, you know what I'm talking about. Right now, about half of Americans, adults in America, are either diabetic or pre-diabetic. Why? Because so many of our foods are high in carbs. We're eating a lot of processed food. We're eating fast food. And this is really throwing we're not having glycemic control. Now, you've probably heard about the ketogenic type of food plans. Well, this is not a fad. This is real. This is real. Yeah, us getting into a ketotic state is actually healthy for us. And I don't have time to go into all of that, but believe me, this is not a fad. But I think a lot of people are promoting all sorts of keto type diets. And from my take on this, looking at all of it and listening to some of the top people in the country speak about this, is that this keto diet should be more plant-based and not meat-based. So I follow a ketogenic type eating plan. I don't call it a diet. I call it an eating plan, which is focused on a lot of vegetables, real food, and small amounts of really good meats. So glycemic control. We got to get our blood sugars in control. When we're burning carbs, that's like burning a dirty fuel. It creates inflammation. When we're burning fat, it's like burning jet fuel. So we really had it all wrong when we were telling people, eat carbs, eat carbs, eat carbs, and stay away from fat. What we need to be doing is eating healthy fats, and we need to lower the fat in our body. We want our body literally eating itself. We want to burn that fat. Number 3, caloric restriction. Now, I'm sure you've been hearing about the fasting craze. It's all over the place. This also is not a fad. The science cannot be disputed on this. Throughout the United States, leading medical centers, I'm talking the Cleveland Clinic, the University of Southern California Longevity Center, I mean, all over the country, Harvard. These centers around the country are studying what we can do with our lifestyle to prevent all types of diseases, including infections, and avoid taking a lot of medications, lowering our risk of needing surgery. By the way, this isn't really good for the medical profession. We make money when people are sick. We really don't make a lot of money if everybody's healthy, but hey, better for you guys, okay? But there's incredible data coming out now on all types of fasting. And while some of these are extreme and they do have health benefits, there are now types of fasting coming out that all of us can do. Simple ways we can do short fastings that are easy to do. Once again, that's beyond the topic of today. But when you hear about fasting, know that this is real. This is not just a religious thing. Yes, Catholics fast during Lent, and Muslims fast during Ramadan. But the people who live the longest in the United States, the group, Seventh-day Adventist in Loma Linda, California. They have the highest rate of people who live into their hundreds and they're not in a nursing home than anywhere in the United States. In fact, it's one of the top areas in the country where centenarians, people who live into their hundreds, live, the highest percentage. And these people just don't eat all day long. They don't eat all day long. And so they're more apt to have an early dinner. They're done, don't snack at night, and they go all night into the next day. So, and they eat a plant-based diet, So the data on caloric restriction, various types of fasting, intermittent fasting, little things that we can do are real. I and my husband are really doing this right now because we're going, how can we up our immunity? And we're doing all of these things, eating real food, even more of it, making sure we've lowered carbs, glycemic control, caloric restriction. And if anybody has any questions, I can tell you what we're doing as far as fasting goes. Number 4, move. Our body is 70% water. It's 70% water. Guess what water needs to do? It needs to flow all day long. And that's what we need to do. We need to be doing all day long, flowing, not sitting in a chair all day long, looking at computers, checking our phones. That's what we're doing today. Sitting is the new smoking. More people are going to die from sitting all day long than smoking. So, and movement ups our immunity. Even our lymphatic system, that's fluid. And when we're moving our lymphatics, and we are really relying on our lymphatics to protect us against all sorts of insults, toxins, infections, cancerous cells. So movement is one of the best things that we can do. And believe me, my husband and I have upped our movement during this pandemic. Since we couldn't go to our favorite gym, we turned our den into a gym. And now we're doing online classes. I mean, every day, if not even sometimes in the evening. Hey, let's do a online yoga class too. And it's been awesome. And as my husband says, we're never going back on this. We've upped our game during this, and we're going to keep it going. Another thing that we can do, all of us can do to up our defense is lower stress. Lower stress. I mean, stress is just the new thing. It's a society-created word. My parents, my in-laws, they never used the word stress. I don't think it was in their vocabulary. They were the greatest generation. They called it life. And here we are stressing out about everything. What does that do? It ups our cortisol, a lot of other hormones, and it creates inflammation. Our body really doesn't like that. The stress response was meant to protect us. Oh, there's danger. I either need to stay and fight or flight, run. So the stress response has its purpose for survival. But the problem is today, we're stressed out all the time. And the stress response that was supposed to save our life is now killing us. So what we need to do is answer the most important question in life if we want to lower our body stress. And what's the most important question? What is in my control and what is not? We need to go, hey, this is in my control. Let me focus on that. If we keep focusing on what's not under our control, we make ourselves miserable, and actually we're creating disability and increasing our risk of death. So we need to, as I call it, deal with reality. So I have a presentation on that, but not today. Another thing we can do is make sure we don't overlook an important component of our health, and that is sleep. Sleep. Most Americans are not getting enough sleep, or they're not getting healthy sleep. And my husband and I have actually lowered, upped our defense by increasing our sleep hygiene. And this was an overlooked component of our health for a long time. In fact, my husband he thought, well, I can function 5 on 5 hours of sleep. Not really. You may think you can, but your body really doesn't like that. Actually, his snoring was driving me crazy years ago. We found out he had sleep apnea, even though he's really thin. I never would have thought he would have it. He has a device now that he uses. His sleep apnea is gone, and it's awesome, and we're all sleeping better. So that's something that's really important. And I'm glad during this pandemic, we're getting more of that. So these are just a few of the things that we can do that I think are top. There's a lot more. Now, some of us may be a bit overwhelmed at this point thinking, I have to do all of these things right now? Oh my gosh, I'm gonna have to totally change my life. No, you don't have to do them all right now. You just need to start somewhere. What can you do today? How can you tweak your food consumption today? Like maybe having a salad rather than a hamburger. I mean, what can you do? It's a beautiful day here in Central Texas today. It's awesome. I don't know about you, but I already have a walk planned, a 4-mile walk plan with one of my friends. I'm going to get outside because I spend so much of my time sitting. I'm working on the next book chapter. I'm working on the next presentation. I'm getting the next webinar ready for a company, about to go online. So I end up sitting a lot. So I put movement into my schedule, usually more than once a day, because the rest of the day I'm sitting, and I know my body's 70% water. It wasn't meant to sit, just stay there stagnant. So these are all things we can do. We can also just today stop for a few minutes, turn off all the electronics, pay a visit to ourselves. Just stop. And even though there's a mess going on right now, just stop and get into a state of gratitude and go and just be blessed for all the things that you have, that a few billion people out there would love to have. They would love to have what we have. And so for us to be able to do that is going to improve our immunity and help us up our defense against disease. So how are we going to do all this? We need to be living well aware, all right? And I and my husband live by 11 essential elements to health and happiness. And we actually started our journey doing a lot of these things 11 years ago. It was April 2008. It was exactly 12 years ago when Dr. Waxman, who is a surgeon at Baylor Scott and White, he drugged me kicking and screaming to our first wellness conference. And that was 12 years ago. We slowly started implementing a lot of these scientifically proven strategies. And importantly, we started avoiding a lot of the stuff that's being sold out there. I don't have any vitamins, minerals, herbs, or supplements to sell you. What I do want to sell you into is a healthy lifestyle. These people who live into their hundreds and that are not into a nursing home, that's what they do. That's what they do. These people are leading a reasonable lifestyle. They're eating healthy. They're lowering stress. They're getting sleep. I mean, they're moving, but most of them don't have gym memberships. They just stay active and move. All right, and that's what we started doing. We just started incorporating things into our life. And we really embraced the World Health Organization definition of wellness, which they say is an optimal state of health of individuals. And it's not only our physical health, it's our emotional health, our social health, our financial health, our spiritual health. And why do we all want to have an optimal state of health? So we can fulfill our role expectations. That's why we want to do this. And the problem is people have this excuse, well, I don't have time to take care of me because, well, I've got to take care of the kids and the grandkids and I'm busy at work and I've got all these volunteer activities. No, we want to take care of ourselves so we'll be able to do all of that even better. Once my husband and I started focusing on our own wellness, all of a sudden we'd be more productive, more creative. We're helping more people. Oh my goodness, every minute you invest in your own health, it's going to come back many folds. And so we started incorporating all of this. So because the truth is, really, thousands of people are going to die in America. Thousands of people are going to die in America this week. Not from coronavirus, but from diseases that were preventable with a healthy lifestyle. What's the number one killer of Americans? By far, self-induced disease. You talk to any cardiologist at Baylor Scott and White or anywhere. Talk to any cardiologist, they'll tell you the majority of heart attacks were preventable. 90% of them have some factors, had they modified them, they would have prevented that heart attack or delayed it for a decade or more. Talk to any neurologist, Jeff Clark. Oh my God, he's head of neurology at Baylor Scott and White. He's an amazing speaker. I have him speak at my wellness conferences. He'll tell you the majority of strokes, overwhelming majority of Alzheimer's cases, totally preventable. Prevention of dementia, totally within our realm. Even if you have the genetic predisposition to it, studies have shown with a healthy lifestyle, you can delay that by more than a decade. It's incredible. The American Cancer Society even released a statement a couple of years ago announcing that almost half of cancer deaths were preventable by modifying one or more of the 8 modifiable factors. There's 8 modifiable factors they talked about. I don't have time to talk about all those, but let me just tell you, a healthy plant-based food consumption and exercise are 2 of the 8. And who doesn't want to prevent? We'll be able to manage all of life's unexpected, unwanted events much better if we don't ignore the weaker links in our wellness chain. Our emotional, social, financial, and spiritual health. Now, what is your wellness score? If I would ask you to say, what is your physical score? What's your emotional score? What's your social score, the quality of your relationships? What's your financial score? What's your spiritual score? What would you tell me? Now, even though the World Health Organization has 5 aspects of wellness, they didn't have a scoring system. So I got together with a bunch of people I know, and being a practicing physician for 40 years, I know a lot of people. I pulled in health experts, psychologists, psychiatrists, financial planners, spiritual directors, fitness experts. I got all these experts in to say, I want to develop a wellness score based on these 5 areas. So if you want to know what your wellness score is, go to livingwellaware.com. On the homepage, you can click on the wellness score, and it'll give you the scoring system. And you don't even have to give me your email address. All right, it's right there on the homepage for you to click on. And be honest. And by the way, it's better to underrate than overrate your score. I want to underrate my score. And I can tell you the top score is 25 if you were a perfect person, which I think a perfect person is a Mother Teresa who can run a marathon, all right? Physically, emotionally, socially, financially, and spiritually, all right? Because financially, she rated a top score. She didn't have anything. She didn't want anything. She had no worries about it. So for me, that's a top score financially when you don't worry about your finances. But believe me, I'm not a 25. In fact, I got my score up to a 20.5. I kind of went half on one of them, but I'm working on getting it higher. But I'd rather underrate than overrate. So I challenge you to check out your wellness score on the site. Once again, you don't even have to give me your email address. And so, in conclusion, we're all going to get through this. We're going to learn from it, and we're going to provide improved healthcare because of it. I have no doubt we're learning a lot in the healthcare profession. And for all of us, it's an opportunity because of this. I mean, all of us have an opportunity during this obstacle to get to that amazing version God created us to be, to have that wonderful life we desire and deserve. I guarantee you, I am really taking advantage of this opportunity to up my wellness game. I'm going, hey, what do I need to do? And as my husband says, we're not going back into some new changes and going, had this obstacle not happened, we never would have done this. We never would have done this. So let's look for the opportunities in the obstacle, and let's all stick together, and let's support each other, and let's make it a goal to be a happier and healthier version of ourselves. It's what we're called to do, and it's all about living well aware. And any of you that want to sign up for my free 1-minute wellness newsletter and blog, sign up. It's free, and I only email you once a week, and it's called 1-Minute Wellness because it takes you about 1 minute for this health tip. Okay, 2 or 3 minutes if I get wordy. All right, for us to really be learning and hanging there together as a community here in Central Texas. So that's kind of where I am. And Rod, if we want to open it up for Q&A.
Thank you, Patsy, very much. Very inspirational. I'm sitting here and I'm a little bit nervous about going to your website to do my score. I was a C student at college, so if I can get at least a C, then I'll be okay. I'll start.
Well, I think the goal right now. And that's what I tell people. There's some people that attend my wellness conferences and their score is really low. They're not in a good place.
Yeah.
But I tell them, embrace where you are right now. Wherever you are, physically, emotionally, socially, financially, spiritually, wherever you are right now, life has brought you to this phase.
Absolutely.
All your life experiences and all your genetics have brought you right here. So embrace that and go, where do I want to be?
Yeah, amen.
And I encourage people to dream big. But embrace where you are now, because if you have the lowest score and all of a sudden you start making changes, those are the people that inspire everyone else. Who inspires me? That person who weighs 350 pounds and drops a couple of hundred.
Wow.
That's inspiring. That person with major depression who all of a sudden started doing all of these things and boom, started doing all these things, and now they're a New York Times best-selling author on happiness. Those people are the ones that inspire me. So, and I always say, had I had a perfect life, I wouldn't be able to talk to you today. Well, because believe me, I had a lot of issues, which I shared at a lot of my conferences, and I embraced those problems that I had, because had I not had them, I don't think I'd be able to do what I'm doing today.
We're thankful so much to have you here. Before we go to the questions, I'll just make one comment about that new norm. And I put it out on the, but typically, as you and I shared a couple weeks ago, if I couldn't sleep or if I woke up really early, I'd just go ahead and get cleaned up, go to work. Sometimes 4 in the morning, 5 in the morning. And my new norm now is walking, and doing more walking. And, it has already paid dividends where I sleep like a baby now. And now I'm getting up too late. At 7 o'clock, I'm thinking, oh, I'm way behind the schedule. So this new norm, grabbing hold of the opportunity to make those necessary changes, improvements.
And Ryan, you had shared that with me about all the walking you were doing. I'm like, oh my gosh. And after I talked to you, I went, I think I'm going to go for a walk. I mean, she like motivated me to get out there and go walk some more. And that's what we want, people sharing these stories at this time. What are we doing personally that we can share with other people? And that's why I know Amy Brown's on now. She handles my social media. She's like, send me pictures. So I'm sending pictures of me outside doing yoga or the home gym, and pictures of my food that I'm eating. So all of these things that we can share with people. Let's share with people what we're doing for them going, that person's doing that. They're eating that. They're doing this. So let's make sure that we're sharing these positive things that we're doing for our health, so we can do what the World Health Organization says. We're working on our optimal health so we can meet our role expectations.
Great. I'm going to refer to Kaylee now for any questions. Do the Q&A. Kaylee?
Yeah, now's the time if y'all have any questions you want to ask Dr. Sulak. You can get on the chat, you can post it there, or if you want to raise your hand, there's an option if you click under the participant option, there should be an option to raise your hand. So if we have any questions, now's the time.
Anybody got any questions? I'd be more than happy to try to answer them.
Lyle has a question. Here, I'll go ahead. You are, Lyle, I'm trying to unmute you. There you go. Oh.
Sorry, I can't hear you.
Lyle, we still can't hear you.
Lyle.
Nope. Why don't you go?
We can't hear you, darn it.
Write it in the chat. Let's do that.
Yeah, if you want to type a question in the chat. For some reason, we can't hear you, Lyle.
How about now?
There you go.
There you go.
Okay.
Yes, we can hear you, sir.
It's probably my headset not connecting like it should. The question I had was just how familiar or information that you have on earthing and grounding for your body.
What exactly do you mean by that?
Okay, you know, as kids, we all used to run around barefoot outside on the ground, which got our negative ions and positive ions exchanged. Well, we don't do that anymore because of various reasons, and I have seen some research and some information from a physiologist that we know in California that talked about earthing and grounding to help with immune and help with inflammation.
There you go. I just want to make sure that I understood, because there's so many terms used interchangeably. Yes, there's no prospective randomized trials on earthing and grounding, but I think of getting out in nature. Getting out in nature, and whether you have your Birkenstock sandals on or you're walking barefoot, do I know that there's any difference? Is there any data? No, but I think just getting out there in nature. The problem is, you know, I was born and raised on a farm and a ranch, hoeing cotton and picking cotton all day long up the road in Hill County. Believe me, we didn't have a lot of shoes, so we were pretty poor. And I had so many calluses on the bottom of my feet, it was easy for me to do that. Now we're wearing shoes all the time, and we get out and walk on a little gravel and we're, oh my goodness. So I think the main thing for us is to get out there in nature and get out there and walk. So people who are walking barefooted, they're first of all, they're out in nature and they're moving. So you can't rule out those factors. But I think just getting outside, and yeah, do I like to walk in the grass in my backyard? Yeah. Yeah. And just all those things that we can do. It's just amazing. We spend so much time indoors, and I was guilty of that. And now I actually put it into my schedule walks and everything with people, and to make sure that I just get outside. And thank goodness we live in Texas and not up north, where it's easier for us to get outside most of the year, which is why I don't live in Chicago. Central Texas, home forever. Yeah. Any other questions? Any questions about fasting or our diets or the best kind of movement or anything like that? If anybody has any questions, I would be more than happy to try to address those and some of the things that Jeff and I have started doing. If anybody has any questions.
Kelly Nix has posted into the chat. She says, have you mentioned turmeric at all? Your suggestion to add this to my routine was life-changing for my herniated disc issues.
Oh, Kelly, thank you very much. And hello, Kelly, I love you. She's awesome. Yeah, I could tell you stories about Kelly. She's not afraid to tell me what I need to do. Thank goodness no one else would. But yeah, turmeric, I'm not one of those people that promotes a bunch of vitamins or supplements and all, but my patients with arthritis turned me on to turmeric. And particularly curamad, which is curcumin is the active ingredient in turmeric, and had really helped their joints. So I recommended it to a few patients. Months later, they're emailing me, running into me at HEB, going, oh my goodness, this has been life-changing. I'm like, really? And my husband, who has a little bit of degenerative joint disease from running marathons, now he doesn't do that anymore, he does more yoga and stuff, takes it. And he knows the yoga is probably the biggest factor in the things that he's doing with his leg exercises. But he takes his brand of turmeric every day. So to lower, particularly the most data we have with it really is on lowering inflammation in joints, because that's easier to study. But there doesn't appear to be any bad effects of turmeric. And for people with joint problems, I think it's really good. And so, and the stories that I hear are amazing. So that's a good one. And I think, but a lot of it is just the antioxidants we can get in our diet. I mean, I sent Amy a picture of what I ate last night, which was a huge salad. Full of all kinds of vegetables, everything in there except the kitchen sink, and avocados to have healthy fat, and getting all that. That's an anti-inflammatory diet. And it was so funny. She asked me, she goes, do you put dressing on your salad? She texted me, and I went, yeah, I use oil and vinegar. And she goes, oh, I use ranch. So she's never seen this. So when I did wellness for A&M, they realized I'm sort of a non-dairy person. Well, I wouldn't say I'm totally non-dairy, but I cut 90% of the dairy out of my diet. And so they gave me this thing. I don't know if you can read it. It says ranch dressing kills. So they found this rock and they designed it and they handed it to me as a reward, a reminder that they are actually making some changes in their diet, and a lot of them did. They quit living off processed foods and they started eating more salads with oil-based dressing. So, Amy, I had to throw that out and show that to you. But A&M gave that to me, and I keep it on my desk as a reminder of working with Texas A&M in College Station with their employees for a couple of years. And I still go back there and occasionally and do some stuff. It's cool. Let's see, your suggestion. Yeah, here we go. Oh, added yoga too. Yoga's awesome. Talking about upping your immunity, lowering stress. Jeff and I do yoga. We've incorporated it into our wellness routine several times a week now. And there's several yoga programs. One of them is on beachbody.com. If you're right now, we're having to do online stuff because we can't go to these classes and stuff. But beachbody.com has 3 weeks to yoga. And you just do it at your pace, because believe me, if you try to do what they do, you could hurt yourself. And I don't try to keep up with those instructors. I think that they were ex-torture agents for the CIA. But there's so many things we can do, and yoga is one thing that is going to be in my fitness armamentarium for the rest of my life. Any other questions or anything? Those are great. Oh, great. Thank you for that nice comment, Kelly. Yeah, the only thing I'm selling is information. I want to give people the best information out there, and I want to sell them information that's scientifically based and stuff that I'm incorporating. And believe me, I'm only going to do the best for myself, because trying to become that amazing person that God created to me is a lifetime goal. And with the changes Jeff and I have made lately, we actually feel like our wellness journey has just begun, even though we've been doing this for 12 years. There's so much out there that we can do. It's mind-blowing. We just have to slowly incorporate this stuff a little bit here, a little bit there. Even if we make small changes over the long run, it's huge. It's huge. Those small changes add up. The main thing is making those small changes and sticking with them and doing stuff that's doable. So I welcome people to email me if you have any questions. My email address was up there. It's my last name, SULAK, @livingwellaware.com, and check out, sign up for the 1 Minute Wellness blog. Hopefully you'll like my health tips each week. So Rod, anything else?
That is it. Thank you so much, Dr. Sulak, and we'll go ahead and wrap things up. Just a quick reminder for all those that are here, we do have another Zoom meeting tomorrow. It's going to be Good Morning Bell County with the Texas Attorney General's office. And that is going to be at 8:30. You can register for that online, just like you did for this one. And again, we thank you all so much for attending us, and hopefully we'll see you tomorrow. Thank you all so much.
All right, thank you very much.